All right, this afternoon is my second session in my talk in Search for Medical Freedom. And just to review, in the first session, we talked about the Rockefellers' monopoly and control of modern American medicine and the radical change from homeopathic and natural medicine to a pill for an ill. This is what the term they used back then. Today, this afternoon, I want to talk about, in my second talk, to discuss a short account of the Christian history of medicine and the influence of the church on healthcare. And at the end, I want to give you some practical and strategic ideas for Christian people in our goal for medical freedom and redeeming healthcare. But before that, I want to go backwards a little in a section, an experience I had in France, in southeastern France in 2011, that kind of is a symbolic definition. We talked earlier about the Hippocratic Oath and the solemn and the serious calling of a physician to serve his patients. So Pastor Truella mentioned, I think he's gone, but he mentioned in his message last night about the Protestant reformer in the time of Calvin, of Pierre Viret. And so we did a biography on Viret. I went to France, French Switzerland and France. One part of the trip was to go to Montpellier, France, which is where the historic medical college of all France was. So they had a university there, and I needed pictures, and we had read in some of his biographies on him, of two important French physicians that he converted from the Catholic faith to Reformed Protestantism, and that was Rondelet and Saporta. So I showed up one morning at the medical college, went to 2 or 3 various offices, finally found the right lady. I told her, I'm an American publisher. Usually that gets a little attention, just a little. I've come to see you from America, right? But I used that many times. So, and I need to get pictures of these historic doctors that are in our book that we want to publish. So she says, all right, follow me. So she takes me up the stairs, and we're walking all the way through this medical college. We go to a room where there's a bunch of keys. She grabs a key, and she says, follow me. So we go through the library where all the medical students are. Now, this is the great medical college of France, the great nation of France. We go through the library, there's all the medical students studying. So she takes me to this little room, and so she says, nobody's allowed in this room. Okay, so I said, where is she taking me? So we go in there, and then, is that what you're looking for? And she points to the wall, and there they are. There's portraits of Saporta and Rondelet that Viret influenced the Protestant faith on the wall. So I take pictures of it, and I hit a home run on that one. I said, well, tell me about the significance of this room. She says, well, this room is where the medical students come and we put the robe on them and they become physicians. But the significance of the room, this is why nobody's allowed in there, it's off the library, is that not only was Saporta and Rondelet on the wall, but there was at least 30 other portraits of the great physicians of 500 years of this medical college in Montpellier, France. So I'm thinking, as the medical student is there and he's putting on the robe, he's in front of that great cloud of witnesses, you could call, if you could use that term, on the wall of all the great doctors that came before him. So the weight and the tradition that's on him, not only must he serve his patients, but he's got to carry the tradition of all the men on the wall. So it really caught my attention. It was really quite an experience that not many people have to be able to go in that room. So historically, the training, the tradition, and the oath is what elevated the physician to such an honorable position in all societies. Today, the medical corporations and establishment are destroying that honorable position. All right, so my second talk. Let's talk about the church history and responsibility to heal the sick. Oh, this is not it. Oops. Sorry. Got it? The next one. There we go. Okay. In Ben Mitchell's article, The Christian Origins of Hospitals, he states this: the modern hospital system owes its existence to the people of faith. Christians have been leaders in medicine and the building of hospitals because their founder, Jesus of Nazareth healed the sick during his ministry on earth. The early church not only endorsed medicine, it championed care for the sick. So the script you see up there of Luke 4:18 is prophetic in the Old Testament of Christ's calling. So we see in the scripture that the Spirit of the Lord was upon him because he has anointed me to preach the gospel to the poor. But also down low and highlighted, you see that he also is the healing of the sick, the recovery of sight to the blind. Do you see the fulfillment of the prophecy of Christ that the care of the human body is never to be separated from the preaching of the gospel? Christ came to redeem the whole of man. We are not Platonists and we're not Gnostics. The true gospel of the kingdom of God reaches not only to the soul of man, but also to his body, to the physical earth, and of course to all of life and all of human existence. Then we see in Matthew 10:8 up on the board, his command to heal the sick. That never changed when he passed away, when he died. Okay, and then of course we see in Mark 16:18, Mark's version of the Great Commission where he says they will lay hands on the sick and recover. So here's my thought here on those scriptures. When the apostolic power gifts ended or declined, the church took Christ's command to heal the sick seriously. They cared for the sick and created hospitals. Listen to your own history. The Church of Jesus Christ has always been the greatest humanitarian institution in the history of the world, period. That is your history, people. All right, let's discuss the history of Christian hospitals. This is a history that most Christians are really not familiar with. It's the history of Christian hospitals. Prior to the great Christian period of the Middle Ages, the Greeks and the Romans had scattered hospitals, and they were basically there to protect and to bring healing to their most valuable commodity, which would have been the imperial soldier. Towards the end of the 4th century, the Christians of the East established the first Christian hospital in Caesarea. This hospital became a model for all other hospitals throughout the Byzantine Empire and later Western Europe. By example, the early Byzantine hospitals had a chief physician, professionally trained nurses, and orderlies. This is key. In the 8th and 9th centuries, Emperor Charlemagne commanded that a hospital should be attached to each cathedral and monastery. These monasteries became centers of health care, brought relief to the suffering. Some of the monasteries even trained their own physicians, and they usually spent about 1/10 of their revenues on health care for the people. The worship of God was a high priority in these monastic hospitals. Most had chapels and were governed by members of the clergy, and there were many times of prayers. The Christian hospital movement grew dramatically in the 11th and 12th centuries in the Middle Ages, of which we as Christians call the Age of Faith. It was not the Dark Ages. It was the Christianization of Europe. And the monastic movement, as Rushdoony said, was a huge part in such a Christianization. Albert Johnson, a medical historian, writes, during these centuries, the Christian faith permeated all aspects of life in the West. The very conception of medicine as well as its practice was deeply touched by the doctrine and discipline of the church. This theological and ecclesiastical influence manifestly shaped the ethics of medicine and even directed its science. Now listen to this. I can hardly believe this point of history. Because of the command of Charlemagne, by the mid-1500s, there were 37,000 Benedictine monasteries that cared for the sick. And I ask, how is that possible? European explorers brought the institution of hospitals with them to Asia, Africa, and North America. The Spanish explorers brought the first 2 hospitals to Santo Domingo and to Mexico in North America. Earlier Chinese and Japanese hospitals were established in the 1800s by Christian missionaries. The same could be said in other key parts of the world of the tremendous humanitarian work of Christian medical missionaries even to this day. In fact, secular hospitals are a modern phenomenon. Christians, we must start remembering our own history. The history of Western hospitals, medicine, and healthcare is inherently tied to the history of Christianity. All right, so now we face the big practical question for our day. How does the average Christian, the church, respond to the tyranny of the corporate medical establishment. So I'm going to answer that with a plaque I have in my study at home. I got it on the web, and it's a plaque from Ray Bradbury's genius work of Fahrenheit 451, which many of you have read. And it says this: if they give you ruled paper, write the other way. Okay? So I love it, and I'm reminded of it every day I see it. And so I've created my own little phrase off of Bradbury's inspiration, and it's this: when you meet any tyranny, we talk about medical tyranny and medical control and monopoly, is resist, opt out, and create the alternative. Again, resist, opt out, create the alternative. The key is creating the alternative. That's where you want to end. So as Christians, we talk about in all the institutions of life, don't you sense that politically, in education, in the media, Paul talked about propaganda, that the whole system is rigged? Everything is rigged. It's rigged against us and our Christian order. So we must create, if the world does their own system, we create a parallel system that's different than theirs, that's based on the Word of God. So we need to create parallel institutions like we've done we're making great strides in education. I bet you there's hardly anybody here that sends their kids to government schools, and that's evidence of it. So, what are the alternatives to medical tyranny? Let me go backwards. Okay, so let me go over these areas. So we see advancements made in the realm to create a parallel system of medicine and medical care. So the first is, which you're all very aware of, is Christian-based medical insurance, which is Samaritan Ministry, started in 1994. They've had 28 years of success of Christian people sharing each other's medical costs. They administer to 80,000 households, 250,000 members. The larger of the two Christian insurance companies would be Medishare, created in 1993. Members sharing medical costs. They have 400,000 members, and they've paid out more than $2.6 billion in medical expenses. This is a start. This insurance is a problem. The other thing I want to discuss, and what's been happening in the last 20 years, especially in the last 10, is concierge family care services. So this is personalized medical services by primary care physicians for a retainer fee. So why did this come about? Well, let's talk about the average corporate doctor that's involved with an HMO or corporate managed healthcare model. So the average doc has got 4,000 patients, panel list, 4,000, they call it a panel. The average spends 10 to 15 minutes per patient. It's limited personal care. It's giving of pills and out the door. And corporate profits, remember, in these kind of managed care doctor's offices, are almost like billable hours. We've got to run the patients through. We've got to have so many per hour. So the doctors and the staff are overworked, and there's long appointment wait times. So the concierge service, I know somebody that works for one in Jacksonville, Florida, and they have a limited patient load of 400 to 600 patients. They charge a retainer fee of $1,200 to $3,000 a year. Usually it's more near $1,200. Sometimes it's a monthly fee. And the retainer fee is paid in cash. So they have same-day appointments. They have 30 to 60-minute appointment times. Can you imagine that? A doctor's office, 60 minutes. Unlimited visits, telephone visits, blood work in the office, and an upscale waiting room. So this is just a little start of some change of people rejecting the normal managed care, health care. Okay, this is a great story here. This is a surgery center. I know somebody had a knee operation there recently, and this is Oklahoma Surgery Center. These are two physicians, Keith Smith and Steve Lantier, and they got tired of the medical practice dealing with the federal government, big corporate hospital cartels, and big insurance. So they decided one day to start their own surgery center without government payments. So they bought on a hunting trip, Smith says, they bought a medical facility that was kind of mismanaged. They started doing surgeries. So by 2003, they built the surgery center in Oklahoma City that you see on the wall there. And they have today 40 staff surgeons doing hundreds of surgeries. Okay, and this is outside government money and no corporate hospitals, and the doctors there love it. What's interesting, Smith talks about in his testimony, you can get on the web, that he and his dad were, for years, had read Lou Rockwell's site, the libertarian site that many of us read. And they just got a vision for getting out of the government system in medicine. And it's tremendously successful, and I think they're a model for many other surgery centers in the country. One more thing on them is they would publish on their website what a surgery costs. So they got a testimony of somebody doing needing a hernia surgery. And he looked all around his city he was at. It was $15,000 on average. And the surgery center in Oklahoma puts on their website, they did it for $3,060. So it's all listed. So, and then they're big into no medical records. And because they don't want anybody, no electronic medical records, it's all on paper. And then the other interesting thing is that you might want to consider is the quality of medical care outside of the United States that's controlled by the medical establishment. I have a friend who lives part-time in Ecuador, and I asked him, what's the medical care? He says, it's fantastic. I had another friend who was going for a hernia operation. This was years ago, and he couldn't get the latest one in because it wasn't FDA approved in America, so he and others would fly to Canada for the operation. This building that you see is part of medical tourism. So Tijuana is south of San Diego. So I'm hearing stories of massive malls of American doctors' offices in Mexico that are not allowed to practice their practice here because they'd be locked up. So they go to Tijuana. So you got millions of Americans going down there. This is a massive medical facility in Tijuana. Okay, the last thought on what you can do practically is, and probably the most important, is your personal and family options of medical care. Because of the condition of modern controlled, the American medical monopoly, it's very critical that you take charge of your own health care. So you need to review everything you do, you eat, you consume, and that influences your health, and make the necessary changes. Diet, exercise, of course, and creating a healthy family environment. Even to the point, your shampoo. You buy shampoo that doesn't have sodium lauryl sulfate, right? The chemical, the industrial chemical that's in most of the shampoo. Study nutrition, get on a strong and healthy supplement program. And then the other big thing here is find alternative medical practice. And if you live near a big city, they're available. And it's a growing movement. And I go to one where I'm at in North Florida, and they're tremendous. They've got me set up on so many supplements, I would never be aware of that on personal study. So there's a lot of things you can do personally to overcome the medical monopoly we have in the United States. Okay, my last thought and my conclusion is a few thoughts. In our battle for medical freedom against the establishment's medical monopoly, we must not forget our history as Christians and our God-given call to heal the sick and for the restoration of honest, effective health care from the work of Christian people, the church, and Christian organizations. When we consider the absolute tight control the establishment has over medicine, and then somebody comes along and suggests we need to change it and redeem it, it's almost like this is just an impossible task. This is just too much. But yet, my final thought is, isn't the Bible and church history full of the impossible and the great accomplishments that come from Christian people who had a vision and the courage to carry it out? Thank you.